Welcome to another episode of the Nuclear Medicine and Molecular Medicine podcast. I know some of you are working under difficult circumstances in times that are quite difficult. Thankfully, in Australia, it's not so bad here. Welcome to another episode of the Nuclear Medicine and Molecular Medicine podcast. And I hope you're in isolation and safe, or you're working hard and taking care of your colleagues in a safe manner. And I'd recommend the International Atomic Energy Agency's recent articles on how to run nuclear medicine in a safe way during the COVID crisis. Luckily in Australia, we've had only limited impact of that, and that's made our life here a bit easier and safer. It also means that there's been a big impact on continuing professional development and also on ability to attend meetings and meet with colleagues. I hope I can help in a little way to help that by continuing the podcast during this difficult time. And I call on you, if you're going to present at a meeting that you're unable to. For example, the Australia-New Zealand meeting is now going virtual. That may occur with other meetings, for example, the US meeting or other meetings where that may happen. But if you're going to be presenting and you don't have a venue to do that, and you'd like to get the news out about your new research or a new clinical impact or a new product or anything else, please email me at rob@nucast, that's nuccast.com, and I'll get back to you, and we can record a interview on Zoom or Skype or whatever, and enable us to get the information out there, because I'm not going to be able to get to meetings to record new episodes of the podcast. But now I'm going to lead you to the current episode, which is about data-driven motion correction. Something's been around quite a long time, but never got traction. So we're going to discuss that and deal with how you can implement that. But please get in touch with me. Just drop me a line and say hi, even if you don't have information you'd like to convey during the podcast. Stay safe, stay healthy, look after your colleagues, and hopefully things will get back to normality sometime in the future. Welcome to another episode of the Nuclear Medicine Molecular Medicine podcast, and we've got Adam here who's talking to us about data-driven motion correction.
That's right, yes.
And before we start, just tell us a little bit about yourself.
Okay, well, let me say firstly, Rob, I'm happy to be on your podcast.
Yes.
I've been watching you for years.
Oh, good, thanks.
I'll introduce myself. My name's Adam Kestner. I'm a medical physicist at Memorial Sloan Kettering. A lot of my work, I guess since my PhD work over the last decade, has been with data-driven motion correction. So it's been a particular interest of mine developing this, I would call it a subfield. Right. I suppose I could frame the challenge for the field.
Yeah, sure. I mean, part of the problem is that motion degrades our images, and we saw that today when we had an example of a dynamic PET which had 0.9 second frames, I think it did, and you could see the chest moving in and out. You see the heart moving all over the place. We don't normally see that, but when that's happening, we realise we're going to be blurring the image by the amount that people move, or if people move around, that's going to blur the image. So it's important that we deal with this problem.
That's right. Motion is an inherent problem in, I would say, all medical imaging modalities, but in particular, PET is particularly susceptible to patient motion because PET scans are acquired over the course of minutes.
Yes.
And patients necessarily breathe, their heart beats, and sometimes you get the patient adjust themselves to get comfortable or so, or coughs. Yeah. So you get bulk motion shifts. So motion is an inherent problem in PET imaging, and it's, I would say, a particular problem. In the early days when PET was developed, people didn't think so much about motion in the 80s and 90s because the resolution of PET was still developing.
Yes.
But in the 2000s and 2010s, we have very high resolution PET technology. And if we want to utilize that technology, particularly in thorax imaging or so, we need to find a way to deal with patient motion.
Right.
And patient motion is a unique problem because each patient breathes differently to different extents.
And they breathe differently each time they breathe.
Yes, yes. And so it's a very personal problem and a personal solution. Some patients, respiratory motion doesn't really degrade their images. They might breathe very shallowly. Other patients we see breathing several centimeters of motion in the thorax, and these are patients that would benefit from us finding a robust way to correct these images.
Right. Well, I mean, from experience, I can tell you, I've seen patients with sleep apnea, for example.
Yes.
And they fall asleep
Yes.
during the scan, and they do a big breath, and it moves a huge amount.
Yes.
And then it totally affects the image.
Yes. So I would say motion is a personalized problem, and therefore we need to find a personalized solution. And that is part of my motivation for working with data-driven motion correction. Now, data-driven motion correction is an alternative to what I would call the standard right now, hardware-driven motion correction.
Right.
So in the 2000s, we recognized patient motion was a problem, and most vendors brought solutions up to the market pretty much based on hardware, so using a camera or pressure belt. You could set the patient up with some hardware-based motion tracking equipment.
Right.
And once you characterize the motion, the different vendors also brought us solutions on how to use that motion characterization to generate motion-corrected images.
Right.
So we've had these solutions for a while. We can find a lot of literature showing what kind of impact these solutions have on activity uptake measurements. But we see the solution hasn't translated to routine clinical utility.
Why?
Certainly for diagnostic PET. So why is that's the key question. What's stopping us? We identified a problem, we brought a solution. Why are we still dealing with this problem in the clinic? I would say we don't know exactly why. The truth is we don't know why. Right now, respiratory gating, according to the traditional methods, really require a lot more work during image acquisition. So technologist sets up the patient, different technologists have different skills in setting up patients, so it's not always consistent. It slows down throughput in the clinic as well.
Right, and technologists get pressure to have throughput in the clinic, right?
Yeah, and often clinical managers have pressures to keep throughput. So it requires more work and more complexity in the image acquisition protocol. And then at the other end, there's still uncertainty how to use this information on the clinician side. So the common approach for respiratory motion correction is to build a gated imager. So we're able to chop up motion information into phases or amplitudes, but ultimately you get noisier images.
Yeah.
So you have an uncertain benefit with uncertain risk.
Right.
And I think that's been problematic for physicians accepting and or requesting this extra effort be made.
Right, and part of the problem with traditional gating with the cardiac is that you're saying, oh, we want similar bits of images at each gate.
Yes.
But we're only going to see that similar bit. We're not going to see the rest of the image that occurs in between.
Yes, so that's another optional way to handle the data. I would say ultimately the way to handle the data depends on how you want, what you need to use the data for.
Right.
But before we get there, once again, this goes back to my interest in data-driven motion correction. If we could take away the efforts associated with acquiring the images, then it changes the equation on cost-benefit because there is virtually no cost to acquiring the images. And then there still remains, at this very moment, a question on how physicians can use this motion-corrected images to improve healthcare. But if motion-corrected images are provided ubiquitously throughout the clinic, available for physicians to use when they want to try to use it, I think that really puts us in a new place for showing the role of motion correction in routine clinical PET.
Right.
Now, data-driven gating is an alternative approach to traditional methods. In what we're doing is we're recognizing that our raw PET acquisition data, the list mode data, inherently contains information in it. And in this case, it's information about motion.
Yes.
I mean, I think there's a bigger trend that we're realizing that data is really very rich. We can do a lot with it. But motion, I think, is a very simple embodiment of an ability to do more with our data.
Right, and as our PET scanners get better, we've got more data in a short amount of time, so we've got more information that you can use.
That's exactly right. These data-driven methods only get better as PET hardware gets better.
Right.
It's a work smarter, not hard. An example of work smarter, not harder, and it's only going to get better over time. We'll get better processing electronics. We'll even get better computer scientists, and we'll get better hardware. And I think actually right now our field is on the verge of translating over to data-driven solutions. Data-driven motion correction has been studied for many years. I've been working on it 10 years myself. My peers have also been publishing in this area. This year, we're seeing for the first time a vendor bring a data-driven motion correction product to the market. So I think we're on the precipice of the technology spilling over from conceptual proof of concept, moving to a shareable solution that could be implemented really at large scales.
Right. Does this gate, or does it deform the image to match a shape, or how does it work?
Right. So if we go back to this idea, I look at motion correction as a two-step process.
Right.
First, we need to characterize the patient motion, and then we need to decide how to use that characterization for clinical benefit. So data-driven motion correction, I would say what we've worked on is how can we characterize the patient motion without making any changes to the protocol, just by reviewing the raw acquisition data. And the question still remains on how to utilize that characterized motion. So it's half a solution.
Right.
But it's half a solution that will, right now what data-driven motion correction can do is replace the only hardware-dependent process in the image motion correction chain. So once we're able to remove hardware entirely, we could play with fully automated solutions that are operator independent, that are run in the background, and can be run on 10, 100, 1,000, 10,000 scans. So we're seeing in the research literature full workflows that take you from image acquisition to useful motion corrected PET image, and there's a few ways to take that route. But I would say once we accept data-driven motion characterization is relevant, then we have a new tool in our chest for developing fully automated, scalable solutions.
Right. So is this available now? Where do people find about it? And the other thing I was going to say, what particular areas do you think it's going to be used for? Ones that come to the top of my mind, a lesion in the lung, for example.
Yes.
Where, at the base of the lung, where it's going to be blurred out of existence if it's moving. And the other one is, of course, in cardiac. For example, we've got sodium fluoride imaging for measuring plaques, and we've had a podcast on that previously. So,
yes.
so the heart moves all over the place. So that would be a real challenge for that one. But that would also be an important one, because being able to characterise plaque. Are those the sorts of areas you think you can use it for?
Yeah, I think those are the two biggest areas that are right now
and let's guess liver would be the other place.
Yeah, well, the lung-liver interface is the most, often you get attenuation issues at the lung-liver interface, because with FDG scans, often you get uptake in the liver. So it's oncology, imaging, lung cancer, cardiac imaging. You could do better quantification if you're able to remove some of the blurring. Alternative, I would say any applications that use quantification
Yes.
will benefit from motion correction.
Yes.
There's not much disagreement with that statement. I think up till now, it's been the question has been is it worth the effort to try to benefit from motion correction? And so if we say it takes no effort, that once again that changes the equation.
Absolutely.
But so radiation dosimetry, for example, is an area that utilizes the better your quantification, the better dosimetry calculations
Right.
you'll be able to get, and that means you might be able to do a better job at tailoring patient therapies.
Right.
So there could be real tangible implications of having easy to use motion correction, and we're going to see that. I'm fairly confident. I've continued working in this area as I believe that this is going to really change the field.
Right. So if it's easy to use, everyone's going to do it, and they might as well do it all the time on everything.
Right. You almost have why not do it.
Exactly.
And I would say there's a bigger shift here is we're recognizing that there's information in our data. So once we recognize that, then why not use it?
So where can you find out? How can you do it? How can you do it?
So there's been two arenas that development of the technology has taken place in. I'm a researcher myself, and we've worked in the research arena. So at first we tried to develop different methods, and my colleagues developed the methods as well. You could find these methods in the literature. Usually you search for data-driven gated PET. You could find much of this technology. Once we got past developing the methods, we got more interested in how to use the method. So develop full workflows, develop data-driven data utilization strategies as well. We took the motion correction research, which has traditionally been done using small populations of scans, 20 scans. We showed we could easily generate studies that have hundreds of scans. So we've been able to use data-driven motion correction to push forward the research arena, and the research arena has showed proof of principle that I think these are good ideas that can impact the clinic. There's been, I would think, a delay in the vendors bringing this product to market. Part of the problem was the current vendor products are selling decently. So I would think the vendors don't have the motivation they may have for another technology because their solutions are selling. But I think everyone recognizes the solutions that are out there now are not working so well. And as I mentioned, this year we see GE bringing a data-driven motion correction product to their PET scanners. I know the other vendors have research versions of solutions, and I suspect we'll be seeing approved products in the near future. Once again, the question is if people will accept this as a new standard or not. So there's no way to tell for sure, but if I was betting on it, I would say within a few years we'll see ubiquitous motion-corrected PET images all across the field.
So what typically happens is one vendor comes up with an idea or comes up with selling an idea first.
Right.
And then people might have had it on the back burner forever, right? But as soon as one vendor starts selling it, then they all start bringing out a product and sell. That's typically what happens.
Right, and that's kind of the exciting part of our field. In research, we try to come up with solutions. To make an impact, they have to get into the market, and in the market, you have market forces.
Right.
So, of course, if we get a product that works well, then naturally market forces will push all vendors to get on board.
So I guess your take-home message is that if you can buy this and you've got a system, then you should buy it.
Yes, I would say if you're buying a new PET system,
yes.
Every 20 years a hospital does that, I would say ask for a data-driven motion correction solution and consider exploring it once you get it. the other thing is, now that this product is hitting the market, right on the precipice of hitting the market, I think there's a lot of exciting research we're going to see in the near future, looking at large population studies, looking at solutions for using this newfound motion-corrected information. Right now, this is an uncharted area that has room for development. And I would say even on the, before you get to utilization, there's still extra room for development on the signal capture side of research. So I think physicists, physicians, technologists, all of us can play a role in really maturing this technology to become a daily standard.
Right, and we could see where it goes from gating of just taking a section of the image to deformation during each one and changing the duration of the deformation and the shape of the deformation. Would that be right?
Yes, that's exactly right. Good point, Rob. And we've seen
different... And to do that, you need bigger data sets, right?
Well, as I mentioned, motion characterization is not new. We've been using hardware for a while, and we've seen vendors bring us different products. Some of them sort data into an optimal bin, so you might throw out part of the respiratory cycle. Many of the products do use nonlinear elastic transformations to bring all the data back to a state where it's as if the patient never moved, when in reality they did move. Each of the solutions that we've seen usually have pluses and minuses. I would say that we haven't seen any perfect solution. The question is what we're doing good enough to make an impact? We don't need a perfect solution. So elastic algorithms, sometimes they overcorrect. This is a potential drawback of that. Optimal binning algorithms, you don't have to make any fancy assumptions. No. You only use raw data, but it's only using a subset of the data.
But it makes it a bit noisier, but it's not going to produce an artifact.
That's right, and it's simple to understand, it's simple to use. Yeah. So I would say each of the solutions have something going for them. We've seen there's different ways you could use the data, and once again, I don't think the bar is finding a perfect solution, it's finding a solution that positively impacts patient care.
Are you suggesting that it's better? Don't let the perfect be the enemy of the better.
Exactly, exactly. And I think this is going to be a fun technology because right now we're not used to seeing motion in our images, and when people realize we inherently can describe motion in our images, it almost looks like magic that all of a sudden this technology we've been working with for a long time, we realize it has a new dimension to it.
Right.
So I think it's going to capture imagination and people's interest, and researchers are going to be interested to bring this to the clinic, and we might finally tackle this problem that's been plaguing our field for decades.
So if you're out there, if you want to learn more about this, you go to Sloan Kettering.
Yeah.
Are you interested in other people working with you on this, or providing data, or that sort of thing?
Absolutely. I think in a bigger picture in our field, we need to get better at working cooperatively, and this is a perfect project, perfect example where that holds true. We don't need to work with small data sets, we should work with large data sets. Research is more impactful if we're able to show solutions extend across single institutions. And once again, this is a perfect example of where we could implement new research structures. So yes, I enjoy getting emails and questions on the topic. I've been kind of working on it for much of my career. If folks are interested in this technology, you could Google data-driven motion correction PET, and you'll find there's 20 or 30 papers in literature right now on the topic. I know the vendors who are bringing products to market have set up very nice websites that explain what the technology is and how it can be used in the clinic. So there are options for folks who are interested in learning more. And once again, I predict in the next few years we're going to be seeing a lot more of this.
And hopefully we can see a lot more of you in the next research project.
Thank you, Rob.
Is there anything else you'd like to add? Or?
I will add very quickly that not only have the vendors brought a product to market, but for the first time in a long time, first time, they've let me put my own data-driven motion correction solution together and share it with others in the field. For a long time, it's been an issue of proprietary access.
Right.
And I think as a field together, we're evolving around how we want to use data. So recently, vendors have given me permission to develop a research type solution that could be used across centers, etc. And so if folks are interested in the research aspect of this field, so not the vendor product, but the research aspect, I've developed an executable that makes research on data-driven motion correction in PET ubiquitously available. So if you're interested in researching this area, feel free to Google me. I have a website, kestnersmedicalphysics.com. There's information on that website about the software I'm talking about,
right,
and what you need to do to download it.
Right, and it runs on different platforms and so on, does it? Or?
Good question. So it's written in IDL. So
okay.
you need to download it's a free virtual machine license.
Gotcha.
So you're not going to need to spend money, and it's a self-contained executable. So at this point I'm not giving out the source code, but all you need to do is double-click it, point it to a raw list mode file, and it processes that file for motion and gives you a bunch of research-oriented parameters that you could use to go on and create motion-corrected images.
Right.
So I guess I'm telling you that while the vendors are pushing this forward in the commercial arena, many of us are continuing to push forward the research-oriented aspects of it, and one of those is a solution that I've developed, hopefully to share across the field.
The list mode data, is that what platform, what vendor, is it just GE or is it something else?
That's a very good question. So each vendor has their own format for list mode data, the data that comes out of the scanner. And usually that data is of a proprietary format. So right now, the software I have works with GE and Siemens.
Right.
I'm interested in expanding that to other vendors. And
So it'll unpack a Siemens file and produce an output, right?
That's where we are right now, yes.
Right. Oh, brilliant.
I like to advocate in the bigger field that we should get together as a community and build a common format for list mode.
Right.
It's not just motion correction that can be
absolutely not.
Research and
learning,
fixed.
It's reconstruction.
Right, it's all sorts, and again, there's a bigger picture of learning how to use our data. I would say we're working with a legacy infrastructure right now. So as a field, we should get together and put together a universal format. Until that time, we need to work in cooperation with the vendors, which isn't a bad thing. But it means that we go a little slower than we might like if we had a easily shareable and readable format.
Right. So the MRI people have been able to do this a bit better because they've had formats that they can share. The PET people need to catch up in that respect.
Yeah, that's exactly right. We can look at what DICOM did for the whole medical imaging community. In the 90s, we came out with the DICOM format. Not only does that make research immensely more doable, but we could see in an entire industry based on DICOM image processing. So we see a lot of startup companies coming with creative solutions. So we have an example of what we can do when we innovate with access to data. And I'm very interested in that area, especially for the sake of developing motion correction.
Yeah, but also deep learning and other things, and reconstruction from raw data, all those sort of things. If we had a list mode data set, common list mode data set, right?
That's exactly right, Rob. And if we look at history, I love talking about history because I think it gives us great lessons for the future. In PET technology has always straddled the forefront of the technology. So PET is a digital technology, and we didn't come about till we had computers capable and processing electronics capable of generating a PET scan. And at that time, also, data-driven motion correction wasn't possible because processing list mode, we didn't have the same speed and data storage that we do in these days. So it makes sense that traditionally PET doesn't have data-driven motion correction and proprietary formats for list mode. But now that we're moving into the 2020s, it's time for us to reassess what we're working with and what we want to be working with. That requires cooperation across the community. Of course, this is part of a bigger conversation, but I've always thought data-driven motion correction is a great vehicle for reviewing and addressing our needs as a field for embracing data-driven type technologies. I think we have a model for developing hardware innovation. We don't yet have a model for developing low-cost software innovation.
Well, let's get it done.
Let's get it done. I like that. And it starts with conversations like these.
Yeah.
And so I really appreciate that you invited me here for your podcast. And
I appreciate your input. Thank you very much.
Okay.
Good.
Thank you.
Thanks.